This is Senate Appropriations, and we're continuing our testimony on the 2024 budget. And we have here today the Natural Resources Board budget request, and the chair of the board, Lana Haskell, is here. And if you want to introduce the staff you have as well, we'll get started.
Thank you very much.
Oops, here, you need to mute it, otherwise.
Yeah, you do. Okay. Thank you very much. And for the record, I am Lana Haskell, I'm the chair of the Natural Resources Board, appointed by Governor Scott in December of 2021, so about 15 months. And with me today is Rachel Monaco, our business director. She's been with well, I'll let her do her own introductions. She's had a lot of roles.
I've been with the NRB for about 6 years, first as a commissioner, governor appointed commissioner in Chittenden County, second as a coordinator, reviewing the technical for applications for the Act 250 program, and I took this role as the business director last June. Thank you for having us today.
Yeah, I'm Pete Gill, the executive director for the Natural Resources Board. I've been in the position for a few months now, since the fall, late fall, and I was previously associate general counsel for the board with an interim working legal and compliance at Norwich University for about 5 years.
So we'll get started. First of all, we'll go to your summary and your highlights. That's about the extent of which then we're going to ask questions.
That's perfect. That sounds great. We included more in our presentation, but we don't necessarily need to cover it in detail if there aren't questions. And I'll just ask again, is it okay to share our screen?
Yeah, go for it.
It's
I
not.
need you to co-host.
There we go. All right. Well, thank you again for having us today on this sunny Wednesday afternoon. For the record, my name is Rachel Monaco. I'm the business director for the Natural Resources Board. We're here today to present the fiscal year 2024 budget request for the Natural Resources Board. Again, we included probably more information than you want to see today in our report, but we wanted to err on the side of inclusion rather than exclusion. So if there are questions, even after today, we're happy to answer those as they come in.
And if we have questions, we assign someone from the committee, so we can follow up if something comes up.
So before I get started, I just want to go, I know that some of you are very familiar with the Natural Resources Board and Act 250, but just a 5-second overview. You know, the Natural Resources Board mission is to administer Act 250 to protect Vermont's environment, public resources, and quality of life. How do we do that? We review Act 250 applications for subdivision and development, really reviewing them to be in compliance with the Act 250 criteria. There are 9 districts across the state, and staff and citizen commissioners from each of those districts review applications that are proposed within those districts. We review approximately 400 applications a year statewide. The Natural Resources Board staff is composed of 25 positions funded through a combination of special and general funds. In addition to that, we have 3 limited service positions that are funded through a one-time ARPA appropriation. As I said, we have approximately 60 citizen commissioners that are tasked with reviewing those applications statewide within their respective districts. 9 districts. The Natural Resources for FY 2024 requested budget, we're requesting just over $3.4 million slated last year. 20% of that we are requesting is coming from the general fund, 80% from our special fund, which is associated with our permit application fees. You asked, for carry forward funds to be included. We included that. We typically have a very small amount of carry forward every year.
I don't think we'll spend a lot of time on the 6 cents.
And one of the priorities for our organization over the next year is to respond to Act 182 of 2022, which directs the Natural Resources Board to prepare a legislative report on the necessary improvements of the Act 250 program. That report is due at the end of this calendar year. I mention it here because the governor's recommended budget includes a one-time appropriation for the NRB to hire a facilitator to aid in that study. Questions before?
So that would be a contract then?
That's correct, yeah,
You're not a limited, so it would be a contract.
it would be, yes.
I have a question on what would be necessary, but that's my job to go back and look at Act 182.
You need the necessary updates to
The
the,
necessary
Yeah,
improvements,
who's
yeah.
deciding whether it's necessary?
yeah, that will be part of the study. We're looking at 6 different areas: location-based jurisdiction, capability and development plan. These are both from the 50-year study. And then a number of areas that focus directly on our operations and governance and how we, fees and different things like that.
Senator Lyons.
So if you're talking about the development plan, are you talking about a statewide land use plan and whether or not to institute that after 50 years? Wouldn't that be nice?
That'll be part of the conversation, right? And I know there's a bill in the House right now, I think it's H5, about having the regional planning commission start to do some regional mapping that starts to pull together.
So let me ask you this, do you mind if I ask a question? It's more
Not money, but.
content, yes, sort of understanding. As you look at that plan process, the planning process, and are you thinking about linking regional plans based on what local communities believe is appropriate for development? Or are you looking at the 10 criteria and evaluating where wetlands or ag soils or ridge tops are located? How are you looking at the mapping process?
We're at the very beginning of the study, and all of those things will come up. I mean, just in preliminary conversations with stakeholders and different interested parties, these types of questions are coming up, and working with a facilitator, we'll start to build out the topic areas, and people who want to participate in each one will be able to. We're really trying to go in with a very open mind, is what I'm trying to say.
And then how will you contrast that with the original intent? I mean, there was some intent in the original Act 250 that's now, so it was left aside because decisions were unable to be made. So
I need a little more input from you on that.
Okay, are you looking at any of the historical development that resulted in no land use plan?
We're looking at all 53 years, yes.
And I guess one of the things that we're dealing with here, and we have a bill that's coming in, I don't know if you testified on S100.
Yes.
But also I think the fact is Act 250 was passed first, then Act 200 when Governor Cunin put in place regional planning. And subsequent to that, majority of towns have actually, maybe have variability, but some have very robust zoning and planning and design requirements. And so how to harmonize perhaps some of these procedures that have kind of occurred over a 50-year period of time, and the extent to which there's redundancy, good or bad, et cetera. So that's, I guess, then part of will be part of that exercise.
Absolutely.
Other questions about just that otherwise? The one-time appropriation then for the, such a contract for that is how much?
$200,000.
Other questions? It sounds like it could be quite a significant task, but I think maybe in the end, if we can make sure that we're kind of harmonizing everything that happens. I said so much we do in state government is kind of like Minoan architecture. We keep adding something here and respond to something here, and it creates kind of a disjointed labyrinth, and then people obviously are very frustrated.
It's like most farmhouses.
Well, that's true.
Well, and I will point out just very briefly that there is language in the section of Act 182 that deals with tiers of regulation, location-based jurisdictions. We talked about where you want development, where you don't, protecting our landscapes, et cetera. So that's most definitely going to be part of this study.
It seems like then that study could help inform some of these, many of the discussions that are currently going on here.
Yeah, and we will definitely be collaborating because of the ACCD study on designations. That'll be happening simultaneously. So there'll be some interaction there for certain.
All right, so unless there are further comments on the work ahead, why don't we go to the recommended summary and highlights?
Sure.
We love bullet points.
Okay, well, great. We came prepared then. So there's really three main organizational improvements and summary and highlights that we want to flag for you today. The first is that in 2022, the Natural Resources Board launched a new online application portal and database. And we did that in collaboration with the Agency of Digital Services. What does that mean? Act 250 applications are completed online now, and there's no longer any need to file paper copies at our office. In addition to that, we have an enhanced database that gives us additional capabilities to track project data long-term.
So if this system then has been launched and it's
Working well.
Working well.
Yeah.
Okay, so that's the main thing is, is it working? Are people complaining because there are glitches, which sometimes happens, or what?
Most times, that's.
Most times whenever you do a new system, usually
I would
there's.
say it's remarkably well received. I mean, and yes, there are little glitches here and there, but they're more for our team than they are the external.
We're actually using a platform that the Agency of Natural Resources has been using for years, so that's actually pretty nice.
Proven technology.
Yeah, right.
Yeah.
I mean, that was part of the reason why we decided to consolidate in that way. Additionally, we have a scanning project that is underway. A year ago, the NRB was awarded a one-time ARPA appropriation of $500,000 to digitize our Act 250 permit records in 2 of our 9 Act 250 districts. Really, there's 3 main goals of that project. The first is to make our records readily available to the public online. The second is to permanently preserve our records. And the third is to reduce our storage space long-term. It's not an overstatement to say that we have a library of material in every office for 50 years of Act 250 records. So that's really the beast that we're trying to tackle with this.
So on the governor's one-time general fund, we should find you here for both the scanning project that you say one-time appropriation and the one-time for the contract that we talked about.
Exactly. Yep.
Which 2 districts are you?
So District 4, which is Chittenden County, and District 7, which is the Northeast Kingdom. We thought that it was a good thing to have some diversity in the first.
There's diversity.
Very different projects, different areas of the state, and if this works for those 2 districts, then we think we can apply it to others. So it was took that head on.
Yeah.
Quick question about archive materials you can't use or you're not part of the state archive system.
So we have We're in the process of creating record schedules for all of our record types. The ultimate goal of this project is to have all of our Act 250 records scanned and then go to the archives for permanent retention. So we've.
So you do use them for permanent retention, but you're still storing a lot of this stuff. in your
Yeah,
own-
up until about a year ago, we hadn't used the archives for much at all. So this is really a new initiative for us. But yeah, the goal is that they won't come back to our offices. The paper copy will not come back to our offices. They'll go to the archives for long-term retention.
They do a good job.
Yeah.
I did have one question that has come up, and I think this got addressed in the past. And that is with your district commissioners and where you have jurisdictional opinions and they turn out to conflict with one another. And yet you're attempting to interpret and apply the same regulations or the same standards. And it becomes very hard if you've got developers that are getting one jurisdictional opinion and versus another. And one that came to mind in the end turned out unnecessary was the Act 250 appeals on the Lamoille Valley Rail Trail. And you had competing opinions. And I remember saying at the time, in government departments, you would say, when you've got a different view, how should that standard be applied? So that you didn't have that disparity from district to district. And did you put in a mechanism so if you've got coordinators, and those are difficult jobs really, to weigh this all out, and is it subject to Act 250, is it not? To have those issues where there might be disparate views come, and then you have kind of your own issuance of clarification on how that policy should be applied. Is that in place now, or did I dream it because I want it?
You may have remembered it, is the way to phrase that. So there was a point where jurisdictional opinions came, and just for a number of years, maybe 2015 to 2017 at most, plus or minus, where reconsiderations came to the board and they reviewed those prior to them going to the environmental court. That was the next, would have been the next step. So we don't have that mechanism in statutes currently. But I will say just, my position's ARPA position for the board, having an executive director helping to be able to kind of manage the having an individual managing and overseeing the district commissions, the district coordinators in their role in issuing jurisdictional opinions as part, and being able to help with that process, making sure that we do have consistency in those determinations as best as we can.
Now we're down to your limited service.
Sure, so good segue. The NRV was awarded a one-time ARPA appropriation, so this isn't part of the budget this year, but we were already awarded a one-time ARPA appropriation to hire 3 limited service positions.
Why would an executive director be a limited service?
Could ask the same question.
You were.
District coordinators.
Well,
There used to be an executive director, and then that position was eliminated, and there was a very strong sentiment that the organization needed an executive director. And so that got incorporated into that 3-year ARPA funding, along with the 2 district coordinators to help with.
So that funding is still in place
It
then?
will be in place through.
Probably coming back next year to say you do need the executive director?
If the funding is in place through December 31st of 2025.
Well, yeah, then we don't need to worry about it this year.
Right.
Which district is that?
So there are 2 district coordinator positions as part of that group of ARPA positions. Those coordinators really, they're technical staff. They review Act 250 applications, and they also write jurisdictional opinions. They're intended to be deployed statewide to really help facilitate ARPA-funded projects.
Where the workload to help.
Exactly. So we have one person that's focused in the southern half of the state right now. We have one person that's focused in the north half of the state. And the idea being that, you know, as these ARPA projects come in, if they need an Act 250 review, that ARPA gets moved along and so do our regular, that nothing gets held up. And that's the idea. Wheels on the bus. stay on.
Well, that particularly came in with the housing, right, with the housing.
The
money.
ARPA
Yeah,
positions?
yes, well,
Funding.
yeah.
Housing is a component of it.
Yes.
There are several other components. We are tracking that in collaboration with other agencies in the state to
Yeah.
kind of coordinate our permitting efforts together. It's, you know, slow to start right now, but we anticipate it ramping up in the next few months.
Well, I think our thinking was that we're infusing all this money that would perhaps be subject, where the projects and work would be subject to Act 250. We didn't want to overload the system or put something ahead and something else falls behind.
That's right.
So,
That's right.
I
Yeah.
think it's been very helpful for that,
Absolutely.
having this. Yeah.
So our performance measures, you know, we have 3 performance measures that we've been tracking for several years. One is the number of appeals. The second is the number of applications issued within 90 days. The third is the total permits issued. Happy to address any questions you might have about these numbers.
So in 20 and 20 was down quite a bit because of the pandemic. I take it
2020, yes, we did see,
right here.
yeah,
but in terms of total permits issued,
yes.
Yeah. But then it picked up in 21, was back down in 20.
I think that's right. I mean, Act 250 is sort of a barometer for confidence in the economy and in the development community. So I think what we're seeing is sort of an uneven recovery off of the pandemic. And I think
Although
those numbers.
with the inflation of the money that we were putting in, one would think you would have an upward blip.
Yeah,
Thank
I mean,
I think
we put hundreds of millions in there.
Labor shortages and the cost of materials.
Well, I think
Workforce, cost of materials, transportation.
I think we're also at a nexus that much of that funding has been issued, but it hasn't quite come yet around to the permitting of those projects. But I think we're really on the doorstep of that. So in FY24, later this summer into FY24, that's where we're really anticipating the peak of the projects to come in to our process.
Well, those projects will, but the thing is gonna slow down is if you aren't ARPA, the interest rates now are 3.5% higher than they were a year ago. And that is gonna have an effect.
Yeah,
I would disagree with that.
I've observed that myself.
Yes, I have too.
Any other questions on
And
this?
the crosswalk is just we're pretty used to that.
Sure. So this is probably the last slide that we'll cover today, unless you have questions.
Your
about the other-
instincts are correct.
Okay, okay.
You know, the roll up and
I think
whatever.
what I'll say about the crosswalk is that really our personnel costs occupy 89% of our budget, and our operating costs are only 11% of our budget. So you see that we have some increases in personnel costs. Those are just normal increases in salary and benefits, as well as we've done quite a bit of hiring in the last year, filling vacancies. It's kind of been a competitive market, as well as we reclassified 2 existing positions. the operating expenses increases are really for our internal service fund charges, so
We're
rent and the like. So I'm happy to answer more questions about this.
Committee, other questions? What I do have here is a request to deal with as a result of court decisions, to be, to clean up some language, but it relates to the fees that can be charged, and it has to do with
Happy to give you an overview.
a cap, I guess, you know, what is each project and how many times can you get 165,000? Right? So what I was saying is that if we make these corrections in the budget, I will have to ask the other committees just to take a look, and what we're trying to do is clarify the fee statute. So I'll work with Senator Cummings in terms of how we want to proceed.
I'm happy to
Your
forward
request.
this to her and to Senator.
I've already done it.
Okay, sorry, thank you.
And Senator Brett.
Yes. So, yeah, Senator Stark.
Yeah, getting back to the performance measures budget report.
Yes.
If in 19, that's 459 permits. So in 21, well, 20 is way down. So somebody had some extra time there to do catching up. So then if you get to 21 and you're back up to 442, you're still down, what, 21 from the 459, but then you move to 2022, you're down 63 from 21, and I think you wanted to hire two new positions to help the coordinators keep caught up. So the question is, are you getting a lot more complicated permits because you haven't got the numbers? I mean, if you could justify them before with the help you had before, and now you're adding two more people, but you have less permits.
They already hired the two.
Are they much more
They've been
complicated?
in place a year.
Well, they've been in place since just beginning of
This fall.
December.
Just this December?
Yeah, just a few months.
Okay.
Yeah.
So they haven't had a chance to.
Yeah.
But
But I get your point.
I'll back up and clarify that in 2022, these are calendar year figures, so not fiscal
Yeah.
year. But in 2022, we had a high level of turnover, which I think is also, we hired 12 positions in the last 15 months. So I think that might have some.
Out of the 24.
So we've had
That
a
could
serious
cause-
amount of turnover.
That could cause
and-
something.
Yeah, that could
Plus
cause
COVID.
some backup.
Right. So, you know, I think that might have a factor into the numbers that you're looking at, and, you know, our limited service coordinators, the two additional staff members, they just came on in
In
December.
December, yeah.
So they're up and training and starting, you know, applications now to get ready
Yeah,
for
they're
those
doing very
ARPA
well.
projects coming forward.
So, I've seen, I thought, I've heard quoted a higher percentage of applications that are completed and approved within the 90-day period. But it seemed like it was over 90% or something. And maybe I'm remembering that incorrectly.
Yeah, it might be a different metric that might be a different metric. But we can look into that and get back to you.
Maybe other people might remember it wrong, but I thought,
Well,
From Senate National, I
oh,
think I've heard 80%.
yeah.
But I don't know what the metric was.
Yeah.
I mean, I went through it in 19. I mean, that was a very good turnaround. And it was,
So the
you know,
difference
very
between,
impressive.
yeah, sorry. The difference between I'm thinking of one other, which the numbers that you're seeing on the screen here include only our major and minor applications. We're not including our administrative applications, which usually sail through our process in a matter of weeks.
So maybe
So-
you were just an administrative.
So, yeah, this is a conservative number.
So if you add in all the administrative, like at 80 million.
I think so.
Yeah. Senator Lyons, you had a question?
I do. So going back, I think, to something Senator Kitchell brought up, and that is the rules of board is writing for everyone to follow, and it goes along with your question about different answers and different outcomes depending on where you are. So one of the concerns that I think has been expressed over time is the consistency of rules. So are you reevaluating your rules and starting to put those together, and what's the resource need to do that?
Yes.
Yes, is the
Oh,
answer.
yes.
We definitely are. I mean, that you just named one of the priorities I have as executive director is looking at both our rules, our statute, in terms of the study. I think that'll all interplay well there, but looking at, our guidance, we do have a state coordinator position that helps out with that piece too, and giving some direction on that level, I think is one of my, certainly one of my priorities.
And that's part of the necessary updates to the Act 250 program, so that there is consistency and there's, more regular procedures that are put into place and implemented.
Yeah, I mean, that'll help a lot. Am I the liaison to the board?
I think
I think
probably
you
you
are.
are.
Yeah. Well, I might want to just chat.
Okay.
That'd be great.
Senator Westman.
In talking about the time, I very rarely hear complaints about, the work that you do and the time that it takes you. The place there's the backup is the private engineers to do the work for people, and particularly for small developers, because the larger developers gobble up all the time with the engineers. And I'll give you an example. I have a small 3-person sawmill in the little town of Fletcher, and they do rough cut timber. It's a 3-person operation, and they just put $120,000 into engineering and almost 2 years into getting to the place to make application. Your application turned around in no time once they went through all the, but that's where the backup is in the process. It's not the work that you do.
This is a lovely meeting.
Well, I'm just, that's where the backup comes up. And for a small sawmill, they can't compete with the large developers to get the engineers, and there's not enough.
Probably the owner, the wife, and the son, the 3 employees.
Well, yes, they have 2 dogs.
Oh.
But, but that's where the backup is in the problem. And and it took them 2 years and 120,000. And that's the problem.
And I guess all of that gets conflated with the Act 250.
Exactly.
Sometimes it's a health department regulation, but it gets attributed to Act 250 as the problem.
Well,
And so
yeah, yes, but that's
Sometimes it-
expensive, and that engineer,
but what's the answer? Not to have an engineer?
No,
I don't know.
No, it
Because the
isn't.
state has so many, has appropriately a number of environmental regulations and permits that are required. We happen to be the catch basin for it.
Yeah.
So we're the ones who say, did you do this? Did you do that? Did you do this? And so we're the ones who, it gets conflated, to your point.
Other comments or questions? So you're the executive director and your funding is time limited
That's correct.
unless,
To 2025.
at which point you'll probably be
I hope so.
All right, other questions? Thank you for being so flexible. Our schedule has been just crazy because of the floor. So thank you very much.
Thank you very much.
And Center
Nice to see you
Lions,
resolved.
Hey, I got that at 3.
if we have any questions, Center Lions will follow up.
Most famous line. Bypass surgery, line.
Right. Yeah, I told that story in here a few months ago.
One of my all-time favorite stories.
It was one of the great articles. It's a great story. Governor Racine was running for governor
We're
against.
on, we're on live still.
Okay, actually,
It was
That-
published.
that's
It was
that good of a
published.
story.
All right, the world can hear your story, I'm just
Well,
saying.
Doug, indicated a lack of support for the southern leg of the bypass down in Bennington, and at that time was akin to chopping your leg up.
Taking down the.
So I
Bennington
took him
Monument.
to, on Saturday morning, this was after the Banner wrote an article. Sabina was the editor.
It wasn't my fault.
And, so I took him to the local radio station where he clarified. And the headline, that the Banner was, Racine has bypass surgery.
It was in quotes, it was
It
your
was in
line.
quotes,
It was
yeah.
your line.
Oh, the Bennington bypass discussions were fabulous.
Okay.
Yeah.
Still.
We're still,
Yeah.
We took it
Now,
out
the
the
southern
bus.
leg, the two legs have been built and they're usable, and we have a wonderful.
well, you know, the old,
welcome center.
The rest of the money.
2 out of 3 ain't bad.
Right.
So,
But
They used it for the rest of
the rest area was an important piece of the whole puzzle.
Yeah.
You just can't get there.
I was gonna say, but the problem is you can't find the way there. Oh, well, all right,
I should have had surgery.
thank you.
Thank you very much.
And committee, I'm going to just break the news that we have to meet Monday afternoon. Because we got a lot more testimony to schedule, and we've got to do it in a way that doesn't compete with floor time, as you can see. Maybe we could get rid of those third readings.
Well, I have a request. I'll wait until others aren't around in case you want to swear. A request about tomorrow.
No, we don't need to go off live. I'm just putting people on notice that Monday, we can meet Zoom. We have permission to do that, and I assume a lot of people will want to Zoom in. And then we can talk about tomorrow. And otherwise, Stephanie, maybe we could whack out at least a half hour of going through. We started on this sheet, and maybe we could just keep going.
Sure.
And even though it's a half an hour, maybe we could at least get through the first page.
Yeah.
Can I run and get my sheet?
Yeah, I have my sheet.
So
It's
the
on, but I put it in the email.
question about
My
tomorrow
computer's
is,
We're online.
oh, okay.
So Monday afternoon.
Yeah, probably 1:30, I was thinking 1:30.
Is there any availability to meet sooner than that?
I have a,
I teach in the afternoon, so.
I have electrocardiology at 2:30 and.
No, we know that you have, you don't even have to bring a slip from your doctor, I believe you.
Thank you. I have a skin doctor to look at my head at 11:30, but. so-
Sure it is a
If you start at 1,
psychiatrist. that looks
I
at
think-
your head.
well, they're gonna be able to view in there if they do any more, taking my scalp away.
Okay.
God.
You can't find yours either?
It's here someplace, right?
Okay.
I didn't know that.
I've had too much time.
Right here.
Had too much time.
And there it is, you're just spreading out.
Do you have to
Yeah,
bring
no,
it
that
after
was
you
right.
have lunch?
No, mine is right
She
here.
had two that she had to do
This
yesterday.
extra one is in your.
There's another one in my house.
All right, so we ended up with DMH on competencies and hearings. Was that in the governor's recommend? 105,000 to expedite competency and sanity evaluations?
I believe that was in the governor's recommended.
I think
Oh, wait, I could look.
Yes, it was from it.
DMH, forensic law backlog, 105.
Yeah,
Yes, it
that's
was.
actually what I was referring to today.
Yeah. So that was governor's request.
The little booklet I should have brought mine over.
This page of the governor's,
You got it way back in
right here,
January.
right here. It's in this document. It's, and we could make a copy of it so you don't have to carry the whole book. But on page 16 is all the listings of the governor's proposed one time. And this item was recommended, and I guess based on your testimony, you
Yeah.
heard on the issue that if you would support it.
Yeah, it's problematic. But the change in allowing doctor level psychologists will help
I don't have a lot, the forensic psychologist.
the back, clear them back. The part of the problem is many of the people make a way to find it, right?
Plastic binder on it.
But one of the, yeah, that is,
Might have taken it home.
the other thing is the initial evaluation as to whether someone
Oh,
needs
is that
to
a
come
good
to
guy?
the hearing
Yeah.
to determine conflict. Those initial ones, I think, could be done. Those-
Well,
it's just,
So you, the 105 is in the gov, and you've got a backlog, and this should help, right?
It's the same amount.
Yeah, it's same amount.
That'll be a,
We are on page, not line number 10.
thank
We're
you.
now to 11, and that's the purchase and renovation of Second Soteria House.
And that was not in the governor's recommended.
All right, so-
That is the one that's down in Rutland.
No, that, the other,
That was
was
the
the one
Howard's.
Howard's had been
Oh.
renting for many years, and we purchased, we did authorize the purchase in the BAA. This is a different,
Okay.
I think it's either a second one or the one in the county.
Same population?
no, the other one was sex offenders.
Yeah.
This Soteria is using a treatment model
So this
that is
is,
medication-free.
so that would be classified as new.
That's new. And I don't remember, did we get that request in the public hearing?
I thought. we
I
did.
Pathways, maybe.
The purchase of a house?
I know, yeah, I think we heard something.
Yeah.
I do think you had a pathways. I don't know if
Not sure if it was purchase of a house.
All right, so before we agree, I
I know
guess
the
we
recommendation from their human service committee.
So we'll put that on as to review. The VCures database implement, we've had VCures for years. What are we doing here, Center Alliance? Is this in the governor's recommend?
All three of the Green Mountain Care Board pieces are in the governor's recommend.
We have not taken testimony, really, did we?
They're coming on Friday.
They're coming Friday? Okay, so we'll just try to make a point of who has Green Mountain Care Board. Is that you? Who has that?
They could actually make
But we can explore that further when they come in. The refugee assistance that I believe was on the governor's recommend.
It was, the house that was
Yeah.
split it into these two pieces, the assessment piece, the inventory and needs assessment, they pulled out on a separate line.
And he had put in just $1 million, so it split out the two. I think,
It's the same amount, it's just.
I think what we're seeing here is an ongoing supplement to the federal funding for refugees. And this is also, it's broader than refugee assistance, because I think we're getting into asylum seekers. And also, I don't know where the parolees fit in relative to refugee assistance funding. I think they probably do, because they're the Afghani refugees.
The parolees are or designation at the federal level, so they would, it's the asylum
Seekers,
that don't have any, don't have any,
but this is for more.
yes, on top of what you did in the budget adjustment, but it is one-time money.
I think we're beginning to see that this is an ongoing, because there was money in the BAA and there was money in the prior year, this year's budget.
It'll be interesting to know who the refugees are by category and then exactly what they need for how long.
So I think we might want to find out in the budget adjustment, the piece that you put in was to go out to the community organizations that were helping refugees. I believe this might be the same activity as opposed to direct assistance to individual refugees.
I think it probably is a workforce development and other supports, maybe.
What about the refugees that have been coming over to Champlain, New York and going to Canada? Now they aren't gonna be,
Those are probably
allowed.
asylees.
pardon,
I bet they're asylees.
some are,
Yeah.
but they can't go west because New York isn't gonna honor. So I'm wondering how many of them will end up on our side of the lake that we'll have to take care of now that.
If they're asylees, the level of assistance is very limited. It's really volunteer homes that are taking them in. Now, if they come and part of what we did in the budget adjustment was to support workforce activities. And so I know our basic ed, adult basic ed, is helping them with literacy, English as a second language. And so they could get some help for providing those educational services through this money. But the federal funds, there's really nothing for the asylees, and they're kind of in a limbo status until there's a hearing, and they can't work. And so they're in, even though they want to work, they can't because they can't get a work permit. So I think those are the population that we're seeing at the border. That they're seeking us, they're asylum seekers. Yeah, so Center Alliance.
Well, so, and to eliminate the wait list and backlog for those hearings, they're going to federal court. Who's making a determination right now? How are they going to handle this? They're going to federal court when they're coming across the border?
There's a network of asylum seekers that have been created around the state. And so that was part of the concern was right now there's no assistance if they need health care, dental care, et cetera. And all the, the room and board and everything is done by a network of volunteer families.
Yeah, well, it would be interesting to know what kind of legal help they're getting to go have their hearing as to what's gonna happen to them.
Well,
It's not here.
no, and
It's not,
Not even
these are all
budgeted.
the people that are coming from Afghanistan and Venezuela.
That's the
and-
point.
the Afghans are under, they're under parolees and they are well addressed.
But that's where part of this money is, that we took testimony
But
in the budget adjustment.
yes, but some of this could go for workforce and other support activities for the asylum seekers. But other than what we're doing through the state, there's nothing for them from federal funding. And getting through the hearing process, I think that actually, didn't we have one of our attorneys from Ledge Council actually do some volunteer work? So they're relying, I think, on pro bono, and it really is stretching a volunteer network. And it sounds like it's gonna get stretched more based on what we're hearing about the border shutting down.
So it is very clear that the 975 is for continuation of the program.
That we had in BAA,
Yes.
Okay.
and that was workforce related.
Yeah, and that was though, had been the Afghans,
Yeah.
had been Venezuelans, had been all the people that were
that came in under refugee status.
Yep.
But then there's this other group that, asylum seekers that are kind of in limbo.
They don't have a federal
They have
designation.
Yeah, but the 975 is where
Now,
I got those back.
so do we
Just
need?
for the refugees.
Yes.
That was in the governor's proposed and the House did it. They just split it up between two things.
Yeah, the 25 is for the comprehensive inventory and needs assessment of Vermont's immigrant community and the organizations providing support to this community. So the 25, the governor did not have that split.
Well, I guess that's agency central office, so that would be on my follow-up list to see what we're studying and why it's necessary. My initials right beside that. All right, the blueprint, and that's the first of 2 years. It's like, why would you start it up and not, have a 2-year pilot?
Just do it.
Well, I guess that's the answer. Either you fund it for 2 years and you've got a pilot, or you say, well, we're not gonna start something up to shut it down before it hardly gets off the ground. So I guess,
Better just put it in permanently, but I know.
well,
That's
they're gonna have
$5
this,
million bucks.
it's a lot of money for 2 years.
Yeah.
And I think the other thing that really is important, and I don't know whether health and welfare is gonna take a look at that, but in the blueprint and hub and spoke expansion,
We are.
and how that looks like relative to the systems in place, because we are getting, we're getting, as I say, federal money that's going out to FQHCs, and a lot of money.
Should be going here as
And,
well.
so if we're doing this, how does that fit with all the federal money that's coming through from HRSA? And
About the settlement funds from the opioid.
We might be able to use it, but that's specifically for opioids, and that would be, I'll have to ask about that. I haven't.
that's,
The PTA blueprint.
the blueprint for health is really to help primary care practices.
I'm in the room, well, but I was looking at, I'm looking at 20, okay. You're
No.
looking at 18
Yeah,
or 17.
17.
17 is where the state and federal money starts, but the program is on lines 20 and 21.
Because it's
And DEVA and the health
or
department.
this global commitment it's showing up.
And that's the expansion.
Yes, but what I would like is a better understanding, because with a lot of your what is the intersection with our substance misuse treatment, including the DAs that are providing mental health care, and you've got co-occurring disorder, and we've got multiple federal funds coming in, one from HRSA and one from SAMHSA, and how they get put together, because the last thing we need, and I know that there's some concern that if we don't do something with designated agencies and we're infusing all the resources in a different area, how you make it so that you're not strengthening one side and
Right,
weakening the
right.
other.
Yeah, so it's related to the total healthcare team approach, so ensuring that you're doing exactly what you're saying. So the blueprint expansion will help. And the hub and spoke change will put mental health into that community health team environment, as well as substance use disorder. So instead of just looking at opioids, you're looking at substance use disorder more globally, and then connecting with community support services. It's really a much improved process to do it that way and try to solve one problem that may not be the real issue.
And
Oh, you want me to take testimony on that? Because I'm dying to take testimony.
I'd like to
Oh, yeah.
know how settlement funds are being used, because I don't want
Okay,
and there's a bill coming
there's a
into
bill,
us.
H 222, you're gonna see it in here after we finish with it. But that, the guidelines for that, I've read through the whole settlement last year and put all this together, but the guidelines for that are extremely narrow. So it has to be used for opioids, and right now it's being used for recovery, some other things. So, but we'll see, we'll just have to see what we can do.
But the bill will be coming in from the House.
We'll have it, we've got it.
Oh, you've got it.
No, it's the third read, I think, tomorrow.
Yeah, I was gonna say, I don't know why it took so long, but it's coming over from the House, and it's a recommendation from the,
Opioid Advisory Committee that.
we've got so many different.
We're
They're
not
not
advising
advising
us.
us.
We're going backwards. We are going backwards, all right?
Well, it's really,
On all these prevention things, why do we just?
Well, I think part of it is, a lot of it also is every federal funding source wants you to do a needs assessment, and we're going out to the same community, you know, with the same process. So, the other thing, I would point out is the blueprint started out as a very small initiative. And the blueprint now is millions of dollars. So.
And it includes almost all, a huge number of our primary care practices, which is beneficial.
But I'm,
It's not this item, Bobby's sharing.
so, Ginny, maybe you could help.
I'll try and help with that,
see
because
that.
it's something that.
I think I'm asking you, how do we systematize all these different initiatives and different funding sources in a way that gets the best use of the money and provides the best level of care? So,
Small problem.
no, not a study committee.
Huh?
Ginny could.
We're gonna have a study.
Well, no, you gotta put a program in place first before you study.
Oh.
For the boards, not after.
All right, so,
You guys said.
here's more money for, healthcare providers, and that's 10 million of general fund and 13.7 of federal.
So the 13.7 of federal is on the wrong line here. That will require technical correction when the bill gets over.
Where does it go?
It's part of the tail of the global commitment piece. It was just misinterpreted over the weekend by
once again, they didn't know what it should be over in the global commitment.
No, it's actually a federal dollar amount. It's just not appropriated as part of this 10 million. I don't know what it is. It's our mistake, and we thought it was the match for the 10 million. But it's a different federal true up amount of money if spending authority needed.
All right. Okay.
We'll
So
fix that.
When's it 10 million for redetermination?
So the 10.534,
Yeah.
that is the portion of the overall Medicaid budget that is one-time in nature, anticipating that the redeterminations will result in a lower, less people enrolled and a somewhat lower cost of expenditure for the program. So that's why we're fully funding the estimated cost of the program in FY24 with this $10 million. But the determination that 10.5 could be one-time in nature because as it rolls out.
the caseload's going down. So it's just funding that higher caseload till the redeterminations are.
The process is complete. It's an estimate, so we'll
And we
find
did
out.
exactly the same thing in this year's budget, except now they extended it, so
Yes.
it was like 9 million or something we were
Yes,
assuming.
we did the same thing last year, but then we got the extension.
Because normally it wouldn't be in a one time.
We would not normally fund, the emergency board adopts the estimated costs through the caseload and per member per month costs in January. And that's just like the general fund forecast
So
as a starting point.
So we have to do that.
You have to
Those are-
fund that.
That's not a.
Otherwise, you would be not funding the e-board position.
So I think we can close that out. We've got more of the blueprint here.
So this is the actual programmatic part of Blueprint in DIVA and in the health department. There's a little bit of this blueprint piece that runs through the non-waiver part of DIVA. That's what those small, this 175 and 186 are. We have in the state only and the non-waiver pieces of programmatic expenditure that run through those line items.
So now we have recovery housing, and we had two requests from the recovery network. One was the $1 million for housing, and the other was for the centers. But the centers would be ongoing. So did the budget include, in the House Pass budget, did they do anything to increase the reimbursement to the recovery centers per se?
I don't believe we did. It's not, I feel like we do this on Sunday much better than I know on Wednesday. I don't believe they added in the Department of Health substance use disorder line an ongoing recovery.
Well, let me ask, what, and Rich, this is, you have health department. And I'm not sure what recovery housing, are we paying housing first? What is, when we're talking about recovery housing, I know like Jenna's Promise includes a residential component, so does Valley Vista, but are we talking about pathways? I don't know, I'm gonna ask you to see if we can understand what that is.
Yeah.
I don't know, does the administration have white papers, or no, they probably don't for this, because I think this was not in the governor's recommend. I think it
Is
came
this
from,
related to the settlement? Well, I mean, is the settlement, I've heard that the settlement 222 was in the budget, but I don't know where it is.
I don't know, how could they haven't even passed the bill.
Well, but it would have been put in the budget.
I don't know. Is that a permissible use for the opioid settlement?
Recovery, yeah, for opioid. No, I think, I don't know about the housing piece.
All right, well, we're gonna hold that out anyway. All right, now, case management for, BBH, case management, criminal justice reform?
That doesn't make sense to
They
me.
did
That's an
include, they did
advocacy
include
group.
base funding for the recovery centers, including Jenna's Promise.
1.8.
1.8 global commitment, so the match on that was.
That therein, I think there's a problem with that because, we made the commitment to Jenna's Promise to do a 3-year program, $500,000 a year. And I think that's within the 1.8, that was the whole pocket for the recovery centers. So I need to dig into that.
I know, I thought it was Jenna's Promise, 1.5 million, and it came in at 400,000 last year.
Well, last year we did 400,000 base, and then we did 100,000 in one-time for Jenna's Promise. So it was a total of $500,000. But it was, the commitment was to do for 3 years. And we did a separate piece, and I can't remember the total.
Well, we'll have to look
for
at the
recovery
request.
center.
I don't remember that, all right, and so the governor had proposed it in his budget. And so the governor on Jenna's Promise
Last year.
and if it was a 3-year proposal, or was a 3-year request, but we only funded
The first
the
year.
first year. So the subsequent years are still out there.
And then I believe we did that as pure general fund and not global commitment money to Jenna's Promise last year. I'll
We
double
did,
check that.
we did it as general fund money, but it was in 2 pieces. It was 400, I think, in base, and 100 was one.
We'll lay it all out. We'll lay out what we did last year. What is
I
going
need
forward.
to sit down with them and go through this. I haven't been able to.
Well, you want your.
I've had so much time.
Next
We
week.
can start from the summary of what we did last year in budget and then add budget adjustment and then go to what's proposed by both the governor and the house. as a
So
way
we need to
follow.
reconstruct that.
Yeah.
I don't know what the case management Vermont is for criminal justice reform.
That's, we all got an
BBH.
email from Thomas Dahl,
Oh,
dated March 21st, and it says Vermonters for Criminal Justice Reform open a specialized community reentry and substance use disorder recovery center.
We need to talk, Ginny, you and I have had a conversation about this.
Yeah.
So all right, now I know exactly what that is, but we need to have some more discussion.
So is that in the House budget?
Yes, but it was not in the governor's.
Well,
It was a request.
yeah, it's an advocacy group.
Yeah, and, all right, and Ginny and I have had some discussion on that and made an invitation to everybody to visit the program. All right, so now ADAP, Misuse Prevention Coalition.
So the 1.59 is in the governor's recommend.
Just a quick question about these two entries. Are these the existing percentages? So we're not dedicating any more of the revenue than we have previous to this session.
So this is general fund being dedicated, not cannabis fund, in anticipation of the cannabis funds. It's one-time general fund to the coalitions in anticipation of the cannabis
Yeah.
funds being available to appropriate next year to the coalitions out of the portion that same
So
split.
it's still headed to the places
Yeah,
that
the
have already
bridge,
been
the bridge
defined.
to when
Yes, no change.
cannabis comes in.
Okay,
So can we get the monies back?
No, this is one-time general fund, and so the
bridges.
thinking is that the cannabis will replace the this next year.
So
Well, they
I'm
gotta
gonna,
get going, they gotta tell people not to stop.
and
Sort through that.
And this is funding of the coalitions, these are the community-based coalitions.
That you funded at about $3 million last year.
And then VDH, 500,000 for.
That's new, that was not the governor's recommend, that's a new request that was for the use general fund to expend on tobacco cessation.
Well, maybe they're getting it through the bill that we're passing.
So they didn't fund the 18 as for tobacco cessation.
Yes, they did at
the
5
very
million.
top, that's the second line from the top.
It's 5 million.
Oh, it's under ADA,
AOA.
AOA, but it's actually under VDH.
Yeah, well, that's where they put it.
And that's where the governor had placed it, under AOA.
Oh, okay, but it's actually in the bill. so
In the bill, it would have gone to VDH.
And then VDH is EMS study, which we know that they're in bad shape,
They're
but I
in bad
thought,
shape.
but they've actually increased the reimbursement up to Medicare further on here. So, in their base, so that
For EMS,
for EMS.
yeah, okay.
But what are we studying here?
I don't
I
know.
mean, that they're in pitiful financial shape.
No,
So how they're structured.
I think a piece of what we're studying is that they can't get anybody, even with the increased reimbursement, they can't get anybody.
Well, all right, so I'm going to suggest it's almost 4, and we're down through, in VDH, you can come back with
Yep.
what you have, and then I'm going to suggest we not go into DCF, it's almost 4:30, and we'll just keep going, cranking through this. And I'm going to suggest we adjourn for today.
Is the EMS study in the governor's budget?
EMS study, I don't
I think it was
believe
part of the bill.
I don't think it's.
It's not in the governor's budget, but there's language in, there's the appropriation of the $100,000 for the study, and then there's language about the report, starting on the bottom of page 167 of this version of the bill, section 312.1. Regional Emergency Medical Services Coordination Study Committee report.
So there's not a separate.
Not a separate bill, it is in the big bill.
Yeah, there's some other stuff in the big bill.
You guys want to look at it.
Yeah.
Yeah,
We should.
I will.